My name is Michel Gilliet. I'm professor and chairman of dermatology in Lausanne, Switzerland. I am past president of the ESDR, and during my presidency we created the Skin Science Foundation, which exists now since June of this year. Why did we create the Skin Science Foundation? Because we know that medicine nowadays is focusing on recognizing disease and treating disease. But as you know, healthcare is becoming unsustainable, and we think that the future of medicine will be to be proactive and understand why health becomes disease and intervene early to prevent the development of the disease. And so with the Skin Science Foundation, we want to capture these early elements from the transition from health to disease in order to be able to prevent disease. And nowadays, there are technological and scientific advances that allow to do this through the generation of large amounts of data that can be analyzed and captured, in the sense that we can capture perturbed nodes that give us hints to what goes wrong and why disease develops. So at the ESDR, we reasoned that the skin is a very accessible organ, and we could be at the forefront of this development. And so we thought to generate the Skin Science Foundation, which will promote this concept of preventive medicine through acquiring big data and analyzing big data to capturing these transition phases. So we also realized at the ESDR that this concept cannot be developed by a single skin science lab, but requires the interaction of multiple partners. So on one hand, we have academia at the ESDR, so that regroups all the skin science labs across Europe, but we want to make it global, so across the world. On the other hand, we think it's very important that we have a partnership with the industry. Industry, they bring other elements. They have a vision for how these discoveries can then be put into therapeutics or intervention, early prevention, and of course funding as well. And then we need, of course, also specific partners such as bioinformatics specialists, technology specialists, the legal part. There's many other little, what we call enablers, which also participate to the whole structure of the Skin Science Foundation. So the Skin Science Foundation basically has three pillars. One is we want to provide a think tank that develops and advocates this idea that we need to focus on health and transition to disease rather than disease. So the think tank is the first element. The second and maybe most important element, or biggest element, is the research. We want to promote research in skin science labs that focus on this disease. So what we are going to do is first develop some shared platforms where big data can be put in and analyzed. The second, we want to fund specific clinical trials which address this concept of transition in the risk patients from health to disease. Then we want to provide also capabilities to analyze these big data for the skin science community. And the fourth point is we want also then ultimately fund basic research which analyzes the causal relationship of our discoveries in the big data. So it's a whole set of steps to come to the point. And the final point is the third pillar is we want to provide a platform for these discoveries to be put in the clinic, so to have an impact, so an impact journey. But this will be the future. Yeah. So as I mentioned, the first initiative we have, and that is ongoing right now, is the creation of a shared big data platform where these big data that are generated from the skin either retrospectively, so data that exists already, or prospectively in clinical trial, can be put in and accessed by the skin science community. This is really our first step, which is ongoing. So we are looking for industry and stakeholders to be involved. I think they bring a separate view from than academic scientists. So as I mentioned before, it's about the impact. So if you have discoveries, the industry really knows how to translate this discovery into a clinical, meaningful, therapeutically meaningful drug, for example. Yeah. The ultimate goal is to generate a medicine that is not reactive and that is not waiting for the disease to develop and treat it, but we want to be able to capture the risk patient and prevent the development of the disease. So it is clear that the patient is very interested in not developing a disease, in capturing the development of a potential disease before it actually happens. That's the trend of the next generation healthcare, because I think it's a concept that not just the Skin Science Foundation developed, but it's healthcare needs to go into prevention rather than in treatment of disease, because healthcare costs are augmenting. It's unsustainable. We need to find out why disease develop and intervene early to be able to block disease development. And I think nowadays we can do that with big data technology, bioinformatics, and the scientific technologies. Well, it will be a celebration of the past 50 years, not only about the ESDR, which has grown over the years to a very large community and network, but also about a celebration of the advances in skin science. And in 50 years, we have had tremendous developments in skin science and dermatological research for the benefit of our patients. So it will be a big celebration for that.